Welcome to immunology lecture, and today's topic is immunity. And what is immunity? Immunity is the ability to recognize and eliminate antigen from the body. So immunity is the ability to recognize and eliminate antigen from the body, and the end result may be harmful or beneficial. So, immunity is the ability to recognize and eliminate antigen from the body, and end result may be harmful or beneficial. Now come to beneficial effect of immunity. Beneficial effect are some clinical and subclinical infection like measles, chickenpox, smallpox produce lifelong immunity. And some artificial measures like vaccine also produce a specific immunity. Now, what are the harmful effects of immunity? Harmful effects are allergic or hypersensitivity states like bronchial asthma, rheumatic fever, acute glomerulonephritis. These occur due to excessive and inappropriate immune response. So, hypersensitivity states like bronchial asthma, rheumatic fever, acute glomerulonephritis occur due to inappropriate and excessive immune response. Autoimmune diseases like rheumatoid arthritis, SLE, these diseases occur due to loss of self-tolerance. And also, graft rejection is another harmful effect of immunity. Then come to classification of immunity. Immunity is mainly two types: innate immunity and acquired immunity. Acquired immunity is again two types: active and passive immunity. Acquired active immunity is of two types: natural and artificial. Acquired passive immunity is also two types: natural and artificial. So this is classification of immunity. Immunity is two types: innate and acquired immunity. Acquired immunity two types: active and passive. Both active and passive acquired immunity is of two types: natural and artificial. Now, what is innate immunity? Innate immunity is present at birth. Before exposure to antigen. It is the immunity present at birth before exposure to antigen. It is non-specific, and there is no immunological memory. And this innate immunity is not improved after subsequent exposure to same antigen. So innate immunity is present at birth before exposure to antigen. It is non-specific immunity. There is no immunological memory and not improved after repeated exposure to same antigen. Now come to components of innate immunity. First, physical components or mechanical barrier. Mechanical barrier. First, keratin layer of skin. Keratin layer of skin. Then, intact mucous membrane. Respiratory cilia. Coughing reflex. Then sneezing reflex. These are some mechanical components of innate immunity. Then come to chemical components. Number 1, acidic pH in vagina, stomach. Then fatty acid in skin and acidic pH of sebaceous secretion. Then lysozyme in tear, spermine in semen. Then lactoperoxidase in breast milk. So these are chemical components of innate immunity. Acidic pH in different part of the body like vagina, stomach, fatty acid in skin, acidic pH of sebaceous secretion, lysozyme in tear, spermine in semen, and lactoperoxidase in breast milk. Then come to cellular components of innate immunity. Innate immunity cells are neutrophil, macrophage, natural killer cells. These are cellular components of innate immunity, and there are some soluble components. Soluble components are complement interferons. Then genetic factor. Some individuals lack glucose 6 phosphate dehydrogenase. Individuals who have deficiency of glucose 6 phosphate dehydrogenase are resistant to Plasmodium falciparum. And there are some miscellaneous factors like immunoglobulin G, which is transferred from mother to fetus through placenta, and immunoglobulin A, which is transferred from mother to infant through breast milk. So these are all components of innate immunity. Then come to acquired immunity. Acquired immunity is produced after exposure to antigen. Acquired immunity is produced after exposure to antigen. It is highly specific, immunological memory present, and enhanced after repeated exposure to same antigen. So acquired immunity is produced after exposure to antigen. It is highly specific, immunological memory present, and enhanced or improved after repeated exposure to same antigen. Now come to difference between innate immunity and acquired immunity. Innate immunity is present at birth, but acquired immunity is not present at birth. Innate immunity is present before exposure to antigen. Innate immunity is present before exposure to antigen, but acquired immunity is developed after exposure to antigen. Innate immunity is non-specific. Acquired immunity is highly specific. Innate immunity is not improved after repeated exposure to same antigen. That means initial response and subsequent response are same. But in acquired immunity, initial response and subsequent response are different, both qualitatively and quantitatively. Mechanical barrier present in innate immunity but absent in acquired immunity. Cells of innate immunity are neutrophil, macrophage, natural killer cell, and cells of acquired immunity are macrophage, T and B lymphocytes. And soluble components of innate immunity are complement, interferons, and soluble component of acquired immunity are antibody, complement, and cytokines. Innate immunity is present both in vertebrate and invertebrates. But acquired immunity is present only in vertebrates. So these are difference between innate immunity and acquired immunity. Now come to active immunity. In active immunity, immunocompetent cells of the host immunocompetent cells of the host participate actively. In active immunity, immunocompetent cells of the host participate actively. Active immunity is of two types: natural and artificial. Example of natural active immunity is clinical and subclinical infection. Example of natural active immunity is clinical and subclinical infection. And example of artificial active immunity is vaccination against a specific disease. Now, passive immunity. In passive immunity, preformed antibodies are introduced to acquire a specific immunity. In passive immunity, preformed antibodies are introduced into body to acquire a specific immunity. Passive immunity is also again two types: natural and artificial. Example of natural passive immunity is maternal immunoglobulin G, which is transferred from mother to fetus through placenta, and maternal immunoglobulin A, which is transferred from mother to infant through breast milk. An artificial passive immunity, example of artificial passive immunity is antisera and antitoxin. Now come to difference between active immunity and passive immunity. In active immunity, there is active participation. In active immunity, there is active participation by the host, but in passive immunity, there is no active participation. In active immunity is started after a latent period, but passive immunity starts immediately. In case of duration of action, active immunity is long lasting, but passive immunity is short lasting. In active immunity, immunological memory present, but in passive immunity, immunological memory absent. In active immunity, secondary immune response occurs, but in passive immunity, there is no secondary immune response. In active immunity, no chance of hypersensitivity. But in passive immunity, there is chance of hypersensitivity. So these are difference between active immunity and passive immunity. In active immunity, there is active participation by the host, but there is no active participation in passive immunity. Active immunity starts after a considerable latent period, but passive immunity starts immediately. Active immunity is long lasting, passive immunity is short lasting. Immunological memory is present in case of active immunity but absent in passive immunity. Secondary immune response occur in active immunity, but no secondary immune response in passive immunity. No chance of hypersensitivity in active immunity, and there is chance of type 1 and type 3 hypersensitivity in passive immunity. So this is end of today's lecture. If you understand, please like and subscribe for more videos. Thank you.